Are you aware of the third leading cause of death in America? If not, I'm going to inform you about the opioid epidemic and how it's negatively affecting U.S. citizens every day. Opioid abuse and overdose are becoming more prevalent. As a college student, I can personally attest that opioid usage is increasing within the young adult population. In addition, it has been proven that opioid abuse is not discussed enough on college campuses. Today, I'm going to present the three main sources that contribute to the increasing number of opioid deaths in America. Pharmaceutical companies, the U.S. government, and the media are the three biggest factors that continue to worsen the opioid crisis. Pharmaceutical companies have encouraged the medical community to overprescribe to patients for decades. Many believe that the opioid epidemic started when Purdue Pharma launched their new drug, OxyContin. In the late 1990s, Purdue Pharma reassured the medical community that patients would not become addicted to OxyContin. This prompted physicians to prescribe them to patients at a much higher rate, sometimes even just for headaches. I've personally experienced the overprescribing issue through a friend at USF. My friend was complaining of side stomach pain and she went to the hospital for a diagnosis. The medical team announced that she had a bruised rib and furthermore prescribed her 3 weeks of Percocet. Thankfully, my friend's pain declined without having to use the prescription, but this raised many questions and concerns. Unfortunately, it has been proven that the pharmaceutical companies continue to encourage the medical community to overprescribe for unethical and money-motivated reasons. On October 19, 2017, Martin Makary, professor of surgery and health policy at Johns Hopkins, stated, "In the U.S. alone, there were 240 million opioid prescriptions dispensed in 2015. This is nearly one for every adult in the general population. Too many people are leaving hospitals with bottles of opioids they don't need." In addition to the pharmaceutical companies, the U.S. government contributes to the increasing number of opioid abuse through their lack of effort. The government does this by placing a higher priority on COVID-19 and reducing the attention and availability to addiction resources. On November 17, 2021, the Centers for Disease Control, CDC, explained, during a 12-month period ending in April 2021, there was an increase of 28.5% opioid deaths during the same period the year before. The CDC believes this to be a result of the coronavirus lockdown. This could be because of the COVID-19 protocols. These protocols cause treatment to be less available, people to lose their jobs, people to be quarantined from family and friends, and most importantly, feel anxious about themselves or loved ones becoming ill. On February 16, 2021, Michael Barnett, assistant professor of health policy at Harvard School of Public Health, mentioned, "The pandemic took away the attention from the media, from legislators, from public health agencies that were previously being focused on the opioid crisis." Although it is recognized that COVID-19 should not be ignored, it is clear that the decisions made by the U.S. government regarding the pandemic resulted in hundreds of people falling into opioid addiction and relapse to cope with their personal and financial stresses. The final contributor to the opioid crisis is the media, specifically television and music. A large way that the media increases opioid abuse is through televised news. Many times, broadcasters will use stock photos and images of drug use and paraphernalia. This has been proven that this alone can trigger relapses. On August 24, 2022, Gateway Foundation, a blog that commonly discusses addictions, explained a study that examined the effects of visual triggers. This study stated, researchers showed participants pictures of cocaine and related situations, and they found that these images resulted in a subconscious emotional response in the brain. These mental responses can lead to cravings and relapses. Another way that the media encourages opioid use is through music. Music is largely influential, and there is an increasing rate of drug usage discussed in modern-day lyrics. On September 10, 2018, Curtis and Daniel Hanba released an article titled "Opioid and Drug Prevalence in Top 40s Music, a 30-Year Review." This article explained, there is an increased prevalence in the lyrical mention of opioids among other drugs. Nearly 50% of 2016 top 40 songs reference drugs or alcohol. This is a critical problem because young adults are extremely influenced and encouraged by the lyrics that they listen to. Television and music both have a large impact on society, and as more and more people glamorize substance abuse, the overdoses are just going to continue to rise. Overall, the opioid crisis has been present for a very long time and has been increasingly getting worse since 1990. You all have been informed of the 3 biggest factors that increase opioid deaths in America. If the pharmaceutical companies, the US government, and the media could come together to create solutions, less individuals would experience the damaging effects of the opioid crisis. Will large American organizations unite to protect its citizens from opioid addiction and relapse in the future?